Assalamu alaikum. My name is Rabia Afzal. I am from final year morning. My roll number is BP1650178 and my topic name is rational and irrational use of ferrous salt. So what is ferrous salt? Ferrous salt medicine used to treat and prevent iron deficiency anemia. फेरस सॉल्ट हम यूज़ करते जब हमारी बॉडी में आयरन की कमी हो जाती है. आयरन इज़ रिस्पॉन्सिबल फॉर द प्रोडक्शन ऑफ हीमोग्लोबिन एंड हीमोग्लोबिन इज रिस्पॉन्सिबल फॉर प्रोडक्शन ऑफ ऑक्सीजन, ट्रांसफ़र ऑफ ऑक्सीजन. तो अगर जब हमारी बॉडी में आयरन की कमी होगी तो हमारी बॉडी में हीमोग्लोबिन की HP की कमी हो जाएगी, मतलब खून की कमी हो जाएगी और हम एनीमिया की तरफ चले जाएंगे. देयर आर डिफरेंट साइन एंड सिम्टम्स जिसकी वजह से हमें पता चलेगा कि हमें आयरन की कमी हो रही है. लाइक हमें फैटिज होगी और टायर्डनेस होगी और हम किसी चीज़ पे कॉन्सेंट्रेट नहीं कर पाएंगे एंड हमारे हेयर लॉस शुरू हो जाएंगे और हमारे नील्स वाइट हो जाएंगे और आँखों के नीचे डार्क सर्कल्स आ जाएंगे. ये सारे साइन एंड सिम्टम्स हैं जो इससे हमें पता चलता है कि हमारी बॉडी के अंदर आयरन की कमी हो रही है. So iron is very important for our body because it is responsible for hemoglobin production. वरना हमारे बॉडी में खून की कमी हो जाती है. So इसमें हमें फेरस सॉल्ट की टैबलेट्स दी जाती हैं जो हमारी बॉडी में आयरन की कमी को पूरा करती हैं. There are different brands like Slow Fe, Ferrous Salt, Ferrous Iron, Mol Iron, Ferrous Salt, Mykids Iron 10. Now dosage. There are different types like oral solutions are also available, oral liquid drops, tablet extended release. There are different dosage forms. Oral solution is 220 mg, 300 mg. Oral liquid drops are 75 mg, tablets 45 mg, elemental 200 mg, 325. Tablet extended release is 160 mg, 142 mg. For males 8 mg per day and for female 27 mg per day. Lactating females के लिए 9 mg per day है and above than 50 years 8 mg per day. Prophylaxis process elemental iron 60 mg PO once daily. Duration during this period like pregnancy or malnutrition treatment is 3 months. Indications: prevention of iron deficiency, treatment of iron deficiency anemia. Contraindication, adverse effects and precautions. Do not administer to patient with other forms of anemia, may cause abdominal pain, nausea, vomiting, diarrhea or constipation, black stool. Do not give simultaneously with doxycycline, ciprofloxacin, antacid. Administer in the combination with ascorbic acid, increase absorption. Therapeutic action, anti-anemic drug. Drug interaction. Proton pump inhibitor, which is thought to inhibit serum iron absorption by increasing the pH of the stomach and decreasing the solubility of ferrous salt. Antacid increase stomach pH and certain anions form insoluble complex when combined with iron. Tetracycline, the absorption of both tetracycline iron decrease when administered concomitantly. अगर हम दोनों को एक साथ देंगे तो दोनों की absorption कम हो जाएगी, तो हमें आयरन 2 घंटे पहले देनी है टेट्रासाइक्लिन के. अगर जब हम आयरन टैबलेट्स ले लें उसके 2 घंटे बाद हम टेट्रासाइक्लिन लें ताकि दोनों की ऑब्जॉर्प्शन कम ना हो. Drug toxicity. Ingestion of more than 60 mg per kg can result in severe toxicity and lead to severe morbidity and mortality. Iron has the ability to produce oxygen-free radicals under aerobic conditions, which turn it into a potential harmful components. However, the overproduction of reactive oxygen species such as superoxide and hydroxide radicals may lead to cellular damage. Free radicals are generated within the cell as part of no cellular mechanism. The generation of free radicals lead to tissue damage and organ failure. Irrational use of drug. The irrational preparation tremendously increase the cost of therapy. The most glaring example of this is that of the best-selling iron preparation, the oxyrange. Frankly, it is an unnecessary syrup-based preparation which is inappropriate for adults. It contains iron salt in fabric form which has an inferior rate of absorption compared to the ferrous form. Till 2000, test preparation also contained from slaughterhouse blood, which was totally unnecessary, irrational, and possibly hazardous. Alternative use of drug. कार्बोनाइल आयरन हम यूज़ करते हैं ferrous salt की. Carbonyl iron is used as a substitute for ferrous salt. It has a slower release of iron and is more expensive than ferrous salt. The slower release affords the agents greater safety if ingested by children. References Lippincott, Chapter 13, Green Drugs of Anemia, page number 423, Steinvogel, Anderson, and Handelman, G. J. and Levin, N. W. Case study on ferrous salt. So there is a case study. Miss T is a 30-year-old woman who presented to her nurse practitioner complaining of 6-month history of intermenstrual bleeding, combined with extreme fatigue and weakness. Her month period now include 8 to 10 days of bleeding and cramping. उनको एक्सेसिव ब्लीडिंग हो रही थी, जिसकी वजह से उनको आयरन की खून की कमी हो गई थी, हीमोग्लोबिन की कमी हो गई थी और आयरन की कमी हो गई थी. So there is our soap notes. Subjective physical examination finding height 5'5" BP 130 80, pulse 98 regular, chest clear. Medical history G2 P2 use NSAIDs regularly for left knee pain from previous sports injury ST. Family history no contributory. Current medication only NSAID. Objective lab result HB 91, SCT 29, RBC 3.3, MCV 19, MCHC 27, WBC 7.9, ferritin 9.7, iron 8. Assessment. Iron deficiency anemia IDA, anemia of chronic disease with vitamin B12 deficiency VBD. Ferritin IDA decrease, ACD increase, VBD normal. Iron IDA decrease, ACD decrease, VBD normal. MCV, MCH, IDA decrease, ACD usually normal to decrease, VBD increase. Plans and interventions. Patient-specific treatment. Diet counseling. Investigate the cause of prolonged intermediate bleeding. Stop the use of NSAID if possible and rule out GI bleeding. Educate the patient how to use iron supplements and about its side effects. Advise patient to keep iron supplements away from children. Overdose is toxic. Start supplementing with iron supplement in conjugation with vitamin C. Initiating therapy can start from 180 mg elemental iron a day and regulate the dose based on patient tolerance and severity of anemia. It is recommended and slowly go up. Order CBC and ferritin and see the patient again in 2 to 4 weeks. Continue treatment for 3 to 6 months. Supplementing beyond 6 months is not recommended. Note: iron is a crucial element for hemoglobin production. It is necessity is especially high in kids and pregnant women due to high demand. Iron deficiency is the most common cause for anemia in general population. Anemia becomes evident when iron stored in the form of ferritin are depleted. Since the biggest source of iron for building new HP recycled from old RBC, even a small amount of chronic bleeding can lead to anemia. Iron deficiency can cause many problems, and iron की deficiency हम different fruits से भी पूरी कर सकते हैं, like apple, banana, and different fruits contains iron. So this is all about iron, ferrous salt tablets, and there are the references: Lippincott, Costa DB, and Juari, Handelman, GJ, and Levin NW. Mitron Halls, E.G., Wisma, iron deficiency anemia. Thank you so much.